Good morning.
Hi.
Good morning. Nice to meet you again. Tell me, Danielle, what brings you to see me?
Well, I don't like my nose, and I wanted to get a nose job.
Hmm?
And I just don't think, I don't like how it looks like when I take pictures or from the side, or I feel like it's too wide.
But in front, it looks beautiful. You know, I mean,
Really?
I'm looking at you. I mean, look, your eyes and your mouth and cheeks and nose. It's a beautiful light reflection on the tip of your nose. So the tip is beautiful. The nostrils are great. So when I'm talking to you and I'm looking at you, so the front face is good. And good analysis that the bones are a little wide.
Yeah.
So bones should be brought in a little bit. That'll open up the eyes and make the cheeks look prettier. And they give me a little profile, just to look away from me. And that's good. And on the other side, can you turn towards your mouth? So now I see what you're talking about. So just file this down a little bit. But this is beautiful. This angle is very pretty. Even when you smile, you don't pull it down. The nostrils are really beautifully shaped. And so a lot of great things. And there lies the art to recognize what's pretty and preserve that, so to preserve the character. So to you, your mom, and your friends and family, nobody knows that what we did fooled the human eye, and yet we refine it to the point that the camera loves it. So I look at everything like through the lens of a camera, and so you want to fine-tune it, you want to finesse it, and yet have no telltale signs that this nose was done, you know? And the other key thing is I do everything from inside, okay? So I do not inflict that cut, which most of the doctors are doing, which is called open rhinoplasty. What I do is closed rhinoplasty, so all the cuts are made inside. So least amount of trauma is inflicted. So the healing, and absolutely no scarring at all. So the healing is really quick. 6 days, I take the bandage off, and that evening you can go out for dinner. And my goal is to get you back into, whether you're going to school or working, to get you back into the society as quickly as possible, and usually it's day 6. So bandage comes off, and that evening you should be able to go out. Now, is it completely healed in those 6 days? No. But it's good enough so you can go out and people cannot discern that you've had any changes.
Yeah.
Because the skin has to mold to the new framework.
Mm-hmm.
So the framework has been touched and altered through the nostril. You get below the skin, and then you work on the cartilage and the bone. You shave it, and the skin will mold. That process of molding takes about a year. So little by little by little, the skin starts to mold and shrink to the new framework, and it looks better. And that's one of the great things, because that's what fools everybody, because they don't see the change. And I would say, So let's go and look at your septum in the other room. I want to see how your breathing is. Can you tell me a little bit about your breathing? How?
Sometimes I feel like I have trouble breathing a little bit, but I'm not sure. It just maybe on one side I feel like maybe I have trouble than on the other side.
Okay, which side is that?
I think my right.
Yeah, and sleep-wise, you sleep well, or do you have to get up in the middle of the night to drink some water because your throat is dry?
I usually sleep pretty well, but sometimes I do get up in the middle of the night to do that.
And when you exercise, you breathe through your mouth or through your nose?
Both.
Both, okay.
Yeah.
So let's go and take a look. We'll take a look and see what the septum is. And if it is deviated, yes, we can fix it at the same time. I'm just going to take a peek. And remember, we talked about you were right. The right side is twisted. Both the cartilage and the bone is blocking part of your airway. On the left side, you're good. And the turbinates are slightly enlarged, so we'll take care of that also. You know, life is about breath, and in yoga they say life is breath. Breath is the one you take through the nose. So I'll give you better breathing. So that's an added bonus. You will breathe better, and then you will have better sleep, better energy, better endurance. It's all about. So that's the kind of breath I want you to take. Okay. And as we talk about it cosmetically, but also then it's a great thing to be able to breathe better for the rest of your
Yeah.
life. You're young and might as well breathe better also.
Yeah.
Huh?
Hi, I'm Danielle, and I'm here at Dr. Kanodia's office, and I'm here to have a closed nose rhinoplasty. Dr. Kanodia has been really great. Like, meeting with him made me feel like really calm and really comfortable, and you know, he welcomed me into his office, and everything he discussed with me about my nose like made me feel really confident in making this change. And I like that it's not like such a drastic change. It's like subtle and will still fit my face.
That's the beauty. The angle, the nostril, everything is same. It's just that we got rid of that little bit of the bump you had. Unbelievable. And it's what, about 5 months now?
Yeah.
Huh?
Mm-hmm.
So we're about 50% healed. It's going to continue to mold. This beautiful. Look at the way the light is reflecting on this versus the bulbousness, a little bit ill-defined. Had a nice tip, but I love the fact that the distance and the angle is the same, and it makes your eyes look even pop out more. What a beautiful,
Yeah, it's a big
subtle,
difference.
yeah. And it's amazing. I'm so thrilled how good it looks. I want to bring your mother in, then I just want to show her the befores. So tell me, what the family and the friends.
Oh my God, they love it. They didn't even notice that anything had been done or anything, but they just kept saying how beautiful she looked and everything. We threw a party for her just to kind of tell everybody, and we told everybody that nobody could believe it, but they thought she was gorgeous.
And the co-workers, when you went
No.
back to work, you went back like day 7 to work, or you
Yes,
took advantage
yeah.
of on day 6.
Yeah, I went back to work and they just asked how my vacation was, but they didn't.
And they didn't know.
No.
They said she looked so well rested and so like relaxed.
And that's the whole art of rhinoplasty, is to be able to make those subtle adjustments and not change the character. And breathing wise, you breathing good?
Yes,
Good,
it's
more energy.
improved, yeah.
Yeah, excellent. Septum, as we just looked at, it's just amazing. Midline and septum is straight, so that's healed. The bones are all healed, so there are no restrictions. You can do anything you want. And so that's how looks amazing.